Hi, I'm Sparks Johnson, and I have with me a special guest, Dr. Gary Lindner. He is a PhD in physiology. Good morning, Doctor.
Good morning, Sparks. Thank you for inviting me to sit down and chat with you.
Well, thank you for sitting down and chatting with me. Let's get straight to the point. What does self-care mean? You're a champion of self-care, so what exactly do you mean? Not too many people
I've been an advocate of that because I find many of us leave our health to chance. So self-care really is about being healthy by choice, not by chance. And it's a simple phrase, but it really it says a lot. It really does.
Do you have any stats for?
Well, okay. It's if we leave our health to chance,
right,
pretty much the chances aren't very good we're going to be healthy. And here's what I mean. The CDC, our biggest problem is chronic disease. Our chances are basically 1 or 2 out of 10 that we're going to be healthy and not have a chronic disease at varying ages in our lifetime. I mean, by the time we're 65, over 80% of us have chronic diseases, multiple chronic diseases, and need to treat and manage those, which becomes our largest expense.
Speaking of expense, how many prescriptions do we use in a year? You were mentioning
the U.S. fills 4.3 billion prescriptions a year.
4.3 billion?
It's nearly doubled in less than 20 years.
You out there in video land, write down 4.3 billion.
It's a lot.
It's a lot of prescriptions. Yeah. Okay, I heard something the other day, and if you don't mind, I'm going to read this so I don't blow it because I wrote it down.
Okay.
Okay?
Okay.
There are 26 million diabetics in the U.S. and 54 million at risk. Don't worry. Don't worry. We can treat and manage your diabetes so you can live a normal, productive life. Now that incensed me, to be honest with you. What would be your reaction to that?
It really makes me mad. It's a brainwashing.
Yes.
Is what it is, and I've heard that. I've heard this commercial before. It comes from what used to be a corner drugstore, which is now called your wellness center, and it has nothing to do with wellness. It really has to do with treating and managing. The part of that phrase that really incests me is normal. They're trying to brainwash that having diabetes is normal. It is not normal. It can be prevented. It's one of the most preventable chronic diseases we have in this country. So it does. It makes me want to really be a champion here and enlist some others to help me in a cause of self-care, taking responsibility for our own health so we aren't treated and managed the rest of our lives.
Now you're doing a Self-Care Matters series, aren't you?
I am.
Why don't you tell us a little bit about that?
Well, it's designed to really show people that being healthy, we have a perception in this country that being healthy is difficult, it's hard. It's not. It's pretty simple. It really is if we make some of the right choices. So in the Self-Care Matters series, we talk about things such as healthy water, or how much water should we drink. You know, 75% of us walk around chronically dehydrated every day. I mean, there are some simple things, and I might say this right now, water is not just a beverage choice. It's an essential nutrient. So we talk about essential, vital things that have been altered through modernization or industrialization, which are a main causative effect for many of the chronic diseases. I'm talking about environmental toxins, too much sugar added to food, in this series, things like that.
Well, that's excellent. That's about all the time we have for this for this video.
Oh, come on, man!
You got a soapbox right behind you, don't you? So I want to thank you for joining us, and I'm sure we're going to be seeing more of Dr. Gary Lindner soon. So thank you very much.
Thank you, Sparks, and I want to commend you on all the good work you're doing with Be Healthy, Be More. You've helped make people aware so they can make healthier choices as well. Thank you, my friend.
Till next time.